Hello everyone, my name is Brooke Williams, and today for my informative speech, I'm going to be talking about electroencephalograms, otherwise known as EEGs. My specific purpose is to inform my audience what an EEG is, how to prepare for one, how to conduct one, and my central idea is an electroencephalogram EEG is a test that detects the abnormalities in brain function. So we get to see different neurological disorders and use that to our advantage to help treat patients. Introduction. An EEG is a test that finds your brain activity. It diagnoses various brain disorders such as Parkinson's, epilepsy, seizures even, stroke, inflammation in the brain, and that of such. I am currently an EEG technologist, and I work in Desert Valley Hospital hands-on with Dr. Zhang to help diagnose different patients. I have administered over 450 brain scans. I have been working for a little over 2 years in the field of EEG technology and have loved every second of it. I want to use my platform today to inform my audience what an EEG is. A lot of people aren't aware, so I just want to shed some light on the area of expertise. What is an EEG? As I said, an EEG measures the electrical signals in the brain and impulses that travel between your brain cells. We use electrodes in EEGs to detect these signals. Electrodes are responsible for sending information to the EEG machine. Your brainwave patterns, they change based on when you're awake, resting, relaxing, or such. And the image on the computer screen is your EEG. So we get to actually record this information, and a healthcare provider will read and assess it. What can you see on an EEG recording? So according to the National Library of Medicine, they say, quote, unlike an EKG, which has a pattern with spikes in it, an EEG shows multiple waves. The shape of these waves mainly depends on how active the brain currently is. This is different when you're awake or asleep or when you're alert or tired. Each wave provides information about the activity of the nerve cells in one specific area of the brain. So brainwaves, they're divided into various different waveforms, one being alpha waves, beta waves, gamma waves, theta waves, and delta waves. Why does a person need an EEG? Why does a person get an EEG done? Johns Hopkins Medicine shares the following. An EEG is used to assess different various brain disorders. We get to see if there's lesions on the brain, tumors on the brain, stroke. If you've had a stroke, what that stroke has done to parts of your brain where we can help and assist you further. We can diagnose Alzheimer's disease, certain psychoses, even sleep disorders like narcolepsy. And EEG will overall assess the electrical activity of the brain and see if there's trauma to it through even drug intoxication or the extent of brain damage from someone who is in a coma. Depending on what the brain injury is, the EEG will assess it. We can see if there's any neurological damage and brain death as well. So, how can I prepare for an EEG if I'm getting one done? No stimulants. Make sure you don't have coffee beforehand because we don't want you to super hyperactive. No cell phone usage. It interferes with the brain waves and the brain scan, so don't use your cell phone. Turn it off. Make sure you're wearing comfy, loose clothing because you're going to be there for a while, so be comfortable, and make sure you shower the day before because any type of oil buildup, products in your hair, it's not going to allow the paste to stick, so we need you to fully have a clean scalp. Why is it important for everyone to know about EEGs? So the amount of people who come into the office thinking they're going to be electrically shocked or hurt in any way, it's alarming. I feel like we definitely need to shed some light on this field of EEG technology because it's not heard about enough, and I don't think people should be scared of it. It's something that's a super gentle, friendly procedure that anyone could get done, and a lot of people have neurological conditions nowadays, like a friend or a family member. You might have came across someone who's had a neurological condition, so just bringing awareness to the field of EEG technology is super important. Don't worry, you're in good hands. Like I said, an EEG scan is considered a very safe procedure that's not harmful at all. It causes no discomfort. It just simply reads your electrical activity in the brain and the electrodes. They don't produce any sensation, and there's no risk of getting electrical shock at all, no radiation. How to conduct an EEG. This is where I come in. So I go ahead and invite the patient in, introduce myself. I let them take everything off of their scalp. That way I have a clear canvas. I lay them down on the bed to a comfortable position. Then I go ahead and take a little bit of paste, put it on each of the 27 electrodes. 2 also are including the heart, and I attach it. Then once all the electrodes are on, I let the patient know the rules. You have to stay still, you cannot move, you need to have your eyes closed the whole time, no talking during the scan. You're more than welcome to fall asleep and relax and rest. And then I start the button and let it read for an hour. Dr. Zhang will then go ahead and review the results and get back with the patient. Conclusion: many people all around the world experience neurological disorders. It's no new thing. EEG technology plays a vital role in helping diagnose these neurological disorders. As an EEG technologist, I've been able to see firsthand the effects of and impacts an EEG has on the lives of people, shedding light on areas that they didn't know that they needed light for. So I appreciate you guys listening to my presentation. This is my bibliography of references I use. Have a great day. Thank you.